In this video, we'll review the topic of bone metabolism, discussing how bone is formed, maintained, and remodeled over time. And then we'll move into discussing common fracture types and the basic process of fracture healing. We'll start by talking through the processes of bone formation, growth, and remodeling. Bone tissue itself is made up of two key components, these being bone cells and the extracellular matrix. The extracellular matrix is the cream-coloured component of the image, which makes up the remainder of the tissue. This matrix is composed of collagen fibers, with these creating a framework, providing bone with its strength and a little bit of flexibility. Minerals are then deposited into the framework, created by the collagen fibers, filling the area, and once crystallized, these minerals harden and give bone its stiffness. We also have four different types of bone cells, these being the osteoprogenitor cells, the osteoblasts, osteocytes, and osteoclasts. Each cell contributes differently within the process of bone metabolism, and we'll look into that during this video. Given our bone cells all sound quite similar, we have listed these here in a glossary format to assist you in your understanding. Broadly, our osteoprogenitor cells are immature cells that hold the potential to mature into other bone cells, specifically osteoblasts. Osteoblasts are often termed the bone-building cell, as it plays a significant role in the development of new bone tissue. Osteocytes are the mature bone cells found in the skeleton. And finally, we have our osteoclasts. These cells are responsible for the breakdown of bone. So now that we've had a quick overview, the next portion of this video will explore each cell in more detail. The first of our four bone cells are the osteoprogenitor cells. These are unspecialized bone stem cells found within the periosteum, and they are the only of the four bone cells to undergo cellular division. After their division, the osteoprogenitor cells mature into osteoblasts. As we mentioned, osteoprogenitor cells develop into osteoblasts, and osteoblasts are the cells which build our bones. A way that I like to use to remember this is that osteoblasts build bones, with B meaning B for blast and B for bone. Osteoblasts firstly secrete a product called osteoid, which contains both collagen and minerals which form the extracellular matrix. The osteoblasts then surround themselves with the extracellular matrix. Some of these cells then become trapped and transition into osteocytes. The remaining osteoblasts, which sit on the surface, secrete calcium and other minerals, which start the process of bone calcification, or the part of this process where bone becomes hard. Osteocytes are our mature bone cells. These are formed as a result of osteoblasts that become trapped within the extracellular matrix that they've formed. In this image here, you can see that we have these dark spots trapped within the matrix, with these being our osteocytes. Osteocytes have an important role in monitoring bone health and regulating bone metabolism, which is the balance between bone building and bone breakdown. They assist the body in maintaining optimal levels of calcium within the blood and within the bone tissue. So far, we have mentioned cells that promote bone growth, but osteoclasts differ from the others in the way that they drive the process of bone degradation. Similar to osteoblasts, I tend to remember osteoclasts as cells which crush bone. C for osteoclast, C for crush. Osteoclasts are formed by white blood cells, and they release lysosomal enzymes and acids, which cause bone tissue to degrade or break down. If we look at the term lysosomal enzyme, you'll see the term lysosome. And from our knowledge of organelles within the cell, we know that lysosomes promote the breakdown of substances. And in this case, they're simply just breaking down bone tissue. This process of bone degradation is called bone resorption, and this is a normal part of bone maintenance and repair. Osteoclast activity is also dependent on the levels of certain hormones and minerals within the blood. For instance, when calcium levels drop below homeostatic ranges, the body responds by releasing a hormone that signals the osteoclast to become active, as the body needs additional calcium. The osteoclasts begin then to degrade the bone, releasing stored calcium from the bones back into the bloodstream to restore balance. Once calcium levels return to the desired range, other hormones will signal for the osteoclasts to decrease their level of activity. So here we have a recap of the 4 different types of bone cells, these being the osteoprogenitor cells, osteoblasts, osteocytes, and osteoclasts. Broadly, we have our bone-building and bone-destructing cells. Our bone-building cells include the osteoprogenitor cells, these being our bone cells that develop into osteoblasts. Osteoblasts help form bone by secreting osteoid, and then they develop into our mature bone cells, or our osteocytes. Finally, we have our osteoclasts, which assist in the breakdown of bone tissue. Bone metabolism is a fine balance between the activity of osteoblast and osteoclast activity. It's imperative that these processes are occurring equally, because if we have our osteoclasts destroying bone at a faster rate than our osteoblasts are building the bone, then our bones can become weak, and this can cause a condition called osteoporosis. Osteoporosis is a clinical condition commonly found in middle-aged and older adults. Looking at the word osteoporosis, we can break this down into osteo, meaning bone, pore, indicating pores or really small holes, and osis, which refers to the abnormality or a condition. With osteoporosis, a person's bones become brittle and fragile, and while there are many underlying causes for this, the main issue is that there is an imbalance present between the level of bone breakdown and the speed of bone formation. Specifically, bone resorption, or bone breakdown, is occurring at a greater rate than bone is being produced. As this happens repeatedly over time, all bones within the skeleton become really fragile and susceptible to fracturing, often spontaneously or under mechanical stress that occurs throughout the day. For example, someone with osteoporosis may have a small fall and break their wrist, whereas a healthy individual would have no consequences. So far, we have discussed the roles that each of these bone cells play in the process of bone metabolism. And now we will focus on the process of bone formation, which is also termed ossification. Ossification occurs in 4 key circumstances throughout the human lifespan, with these being during initial embryological and fetal development, so this being when the embryo matures into a fetus, and further as the fetus is developing within the womb. Now in this unit we do not discuss this first point, as it's just beyond the scope of our unit. However, I just wanted to highlight this, as ossification also occurs during every phase of development. Ossification also occurs when bones grow before adulthood, when bones remodel, so this being the process in which old bone is replaced by new bone, and finally, when fractures are being repaired. During infancy, childhood, and adolescence, bones throughout the body grow in 2 ways. In these periods, bones both increase in length and in thickness, and these are known respectively as interstitial and appositional growth. Interstitial growth is the process in which bones lengthen, or where bones become longer, and this occurs within our long bones at the epiphyseal plate. Looking at this diagram, we have an epiphysis at the top, with the articular cartilage on the surface which articulates or comes in contact with another bone. As we move distally along this diagram, we have 4 coloured regions which collectively represent the epiphyseal plate. As we keep moving distally, we have the diaphysis, or the shaft of the bone. Interstitial growth involves the following 2 major events. First, we have the growth of cartilage on the epiphyseal side of the epiphyseal plate, and then we have the calcification of old cartilage tissue. In this diagram here, we're again talking about the 4 coloured regions which collectively represent the epithelial plate. In the pink, we have the zone of resting cartilage, which essentially anchors the epithelial plate to the epithesis. We can remember this zone by remembering that it's in the location where our cartilage isn't growing. It's simply just resting. The purple region is known as a zone of proliferating cartilage. In this zone, our cartilage cells, which are called chondrocytes, are proliferating, so dividing and increasing in number, which results in the lengthening of our bone. As we move into the green region of this diagram, we have the zone of hypertrophic cartilage. And in this zone, the chondrocytes, or our cartilage cells, are increasing in size and they're getting larger, also resulting in bone lengthening. Finally, we have the zone of calcified cartilage. And here is where the old dead chondrocytes are being broken down by osteoclasts and being replaced by newly formed bone tissue. So, to summarize this process of interstitial growth, we first have the growth of cartilage at the epithelial end of the epithelial plate in the zones of proliferating and hypertrophic cartilage. And then we have the replacement of cartilage on the diathesial end of the epithelial plate, with bone tissue occurring in the zone of calcified cartilage. The repetition of these processes over time leads to our bones growing in length. When adolescence ends, bones can no longer grow in length. However, they can still continue to grow in terms of thickness, and this process of bones increasing in thickness is called appositional growth. This process involves osteoclasts and osteoblasts working simultaneously. Now, if we cast our minds back to the components of bones, we'll remember that the periosteum is the outer layer of our bones. In the process of appositional growth, cells within the periosteum differentiate into osteoblasts. These osteoblasts secrete osteoid and gradually mature into our osteocytes. At the same time, we have our osteoclasts within the wall of the medullary cavity, and these osteoclasts are slowly eating away the bone tissue from the inside of the bone and increasing the size of our medullary cavity. So, to put this very simply, the osteoblasts are working hard on the outside of the bone to lay down new bone tissue, and at the same time, osteoclasts are breaking down the inner layers of bone. So while the overall bone will increase in diameter, the amount of bone tissue or the thickness of bone will remain the same. So now we've discussed how bones develop throughout the lifespan, we can now look at how bones remodel and how bones heal after a fracture. As we know, bone remodeling is the ongoing replacement of old bone tissue with new bone tissue. Like other tissues, bone development occurs before birth. But bone is also a dynamic tissue that is continually being replaced and renewed during the lifetime, with around 5% of your total bone mass being remodeled at any one time. Remodeling simply involves the destruction of old bone tissue through osteoclast activity, which is followed by the production of new bone tissue from the osteoblasts. And it's this process which makes bone such a dynamic tissue, and it allows bone to adapt to external stimulus. For example, bone strength is related to the amount of stress the bone is placed under. So if you subject your bones to heavy loads like what is done when participating in strength training, your bones will respond by growing thicker and increasing in strength. It's also important to remember that new bone tissue is much more resistant to stress and fracturing than older bone tissue. And in that way, remodeling is also considered a protective process. The final circumstance in which bone is formed occurs in the event of fracture repair, which leads us into our next learning objective. We will first identify common fracture types and then discuss how fractures heal. Broadly, fractures are known as a break in a bone. Once a fracture is identified, it's then classified based on severity, complexity, the shape or direction, and the position of the fracture. Some fracture types are also named after the physician who first described them. And while there are many types of fracture categories, we will just focus on some of the common fracture types you may encounter. Fractures are firstly identified as being either closed or open fractures. Closed fractures are those termed as simple fractures, and these are fractures in which the bone has broken but the skin remains intact. Open fractures, on the other hand, occur when the skin is damaged because of a fracture, and this often results in a portion of the bone protruding through the skin. Open fractures are also termed compound fractures, and as I mentioned, this occurs when the broken bone pierces through the skin with part of the bone now exposed outside the body. These fractures commonly occur in the fingers and other long bones. However, it can really happen to all bones throughout the body. In these images, you can see we have a fracture of the humerus, this again being the bone of our upper arm. Within the diagram, you can see that the bone has fractured and the distal portion of the humerus has broken through the skin. The X-ray image is demonstrating the same injury. If you look closely, you can see that the fracture has caused a puncture in the skin right near the site of the fracture, opposite to where that white arrow is pointing. These fracture types also come with a risk of infection, as the skin can no longer protect the bone and surrounding tissues from pathogens. Comminuted fractures occur when the bone splinters or shatters into several pieces at the site of the injury. In the image here on the left, you can see that the humerus has again been fractured, with the bone shattering into multiple fragments at the site of impact, and these smaller bone pieces lie between the two main pieces of bone. You can see in the X-ray image that the humerus has been fractured and the bone has broken away into multiple pieces from the site of injury, and that's shown with that white arrow once again. Impacted fractures are those in which one end of the bone is forcefully driven into the other end. Here in the diagram, you can see that the humerus has been fractured, and the upper portion of the bone has been forced inside the cavity of the bone below the fracture site. This is a little harder to see in the X-ray image, but if you look quite closely, you can see the overlap of the two bony portions at the site of the injury, or where that white arrow is pointing. Impact fractures often occur as a result of a fall, where there is suddenly a high amount of stress placed on the bone. Green stick fractures or partial fractures are those in which the break in the bone is incomplete, meaning that one side of the bone fractures while the other side bends. These fractures get their name because it is thought that they resemble the breaking of a twig that is green. One side breaks, while the other side bends under the pressure, remaining unbroken. And you can see that in these images here. Here we're looking at green stick fractures of the bones in the forearm. And in both the diagram and the X-ray, you'll notice that one side of the bone remains complete, while the other side has fractured. Green stick fractures only occur in children, as their bones are more flexible than adult bones. The bones of children are not yet fully ossified and contain more organic material than inorganic material, and this allows them to bend to a higher degree. The final fracture type we will discuss are epithelial plate fractures. As the name suggests, this occurs when the bone fractures near or breaks through the epithelial plate in long bones. Just like green stick fractures, epithelial plate fractures can only occur in children and adolescents, as this plate ossifies and matures into the epithelial line during adulthood. These type of fractures are quite serious, given they can interfere with the normal bone growing process. As we know, the epithelial plate is the site of interstitial bone growth. Therefore, this type of fracture may disrupt cellular communication and blood flow, affecting how the bone develops. If not properly treated, the epithelial plate may close or ossify prematurely, leading to growth abnormalities, which may cause the injured bone to end up shorter or misshapen compared to the unaffected side of the body. A leg length discrepancy occurs when there is a significant difference in the length between the right and left leg of an individual. There are several underlying circumstances which may lead to a leg length difference, and an epithelial fracture is just one possible cause. If a child or an adolescent experiences an epithelial fracture in their femur, this being the bone in their thigh, or in their tibia or fibula, these being the bones in the lower leg, it can result in premature closing of the epiphyseal plate. As a result, the bone may stop growing, while the opposite limb continues to develop normally. Leg length discrepancies can impact a person's posture and their ability to walk. In some severe cases, surgical interventions, such as limb lengthening procedures, may be needed to restore an individual's level of functioning. So now we have an understanding of fractures, and we can also identify several common fracture types. We'll now explore how a bone heals after obtaining a fracture. The process of fracture repair can be separated into several phases, these being the reactive phase, the reparative phase, and finally, the bone remodeling phase. We'll go through these individually on the next slides, but it's important to note that the basic principles of fracture repair occur in response to any fracture type. We'll look at the process of fracture repair over time. Using this image, we've separated each of the 4 phases out from the initial reactive phase on the left, all the way to the bone remodeling on the right. The reactive phase occurs within the first few hours of following a fracture. When the bone breaks, blood cells within the bone tissue and in the periosteum are damaged, and blood begins to flood into this area. In a matter of hours, this blood forms a clot at the fracture site, and this is called a fracture hematoma, which you can see in the diagram on the left. This hematoma usually forms within around 6 to 8 hours after the fracture has occurred. As blood flow is disrupted to the bone tissue, bone cells near the fracture begin to die, and the area becomes swollen, inflamed, and can be also quite painful. The reparative phase is the second phase in the fracture repair process. This phase firstly begins with the formation of the fibrocartilaginous callus. The fibrocartilaginous callus is a soft structure made from cartilage and collagen, and it essentially acts as a bridge between the broken portions of bone, holding them together. This callus usually takes around 2 to 3 weeks to form. During this period, blood vessels also begin to grow into the fracture hematoma, allowing phagocytes to circulate into the area and clean up the dead bone cells. The second component of the reparative phase is the formation of the bony callus. During this period, we have our osteoprogenitor cells from the healthy portion of bone closest to the fracture site. These then mature into osteoblasts, and these osteoblasts start to lay down new bone tissue, eventually replacing the fibrocartilaginous cartilage and connecting bone fragments together again. Over time, this new bone tissue is converted into spongy bone, and this is now called the bony or the hard callus. And this bony callus lasts for around 3 to 4 months. The third and final phase of fracture repair is called the bone remodeling phase, where the body remodels the bony callus. Within this phase, osteoclasts break down the dead portions of bone around the fracture site, and over time, the bone is remodeled so that it returns to its original shape. And to recap those phases again in a text format, we have several phases that collectively make up the fracture repair process. Firstly, we have the reactive phase. In this phase, blood vessels at the fracture site break open. A fracture hematoma then forms 6 to 8 hours after the injury, and bone cells in the area die as a result of disrupted blood supply, triggering swelling and inflammation. We then have the reparative phase. This starts with the formation of the fibrocartilaginous callus, with collagen and cartilage fibers being laid down to connect the bone portions together, with a soft bridge-like structure, this being called our fibrocartilaginous callus. We then move into the bony callus formation portion of the reparative phase. Osteoblasts begin to lay down bone tissue, eventually replacing the fibrocartilaginous callus with spongy bone, forming our bony callus. Finally, we have the bone remodeling phase, where osteoclasts and osteoblasts undertake bone remodeling and the bone returns to its original shape. We've covered a lot in this video lesson, but to recap some of our main points. We know that there are different types of bone cells, and broadly we can categorize these as our bone building cells, so these being our osteoprogenitor cells, osteoblasts, and osteocytes. And then we have our bone crushing cells, with these being our osteoclasts. We discussed the difference between interstitial and appositional growth, and specifically where they occur in the bone. And finally, we identified several common fracture types and discussed the phases in which bones repair after obtaining a fracture. Thanks for watching this video, and we'll see you in the next video lesson where we'll explore the muscular system.